Good evening and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I am Councilmember Priscilla Tyson, President Pro Tem of City Council and Chair of the committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair. This includes Health and Human Services, Finance, and the Workforce Development Committees. The goal of these hearings is to promote transparency and provide an opportunity for city residents to learn and speak on legislation that impacts their lives. Further, the intent is to review legislation that will be on City Council's agenda for the following 2 weeks. The speakers presenting this evening include, from the Department of Finance, Dan Giangardella, who's the Deputy Director. Also from the Department of Finance will be Chris Long, the Fiscal Manager. From the Auditor's Office, Melinda Frank, Income Tax Administrator, and from Columbus Public Health, Dr. Mashika Williams-Roberts, Medical Director and Assistant Health Commissioner. In addition to covering the legislation in this evening's hearing, the city's 2017 second quarter review will be presented. In the first segment of the hearing, I will ask Finance Director, Deputy Finance Department Deputy Director Dan Giangardella to review the city's financial position. The quarterly review will examine the projected financial condition of the city for the remainder of the year based upon a review of revenues and spending to date for all departments and offices. Before turning it over to Deputy Director Dan Giangardella, I would like to share a few words. I can say with certainty that Columbus is one of the best managed cities in the entire country. For the 38th consecutive year, the city received a Certificate of Achievement for Excellence in Financial Reporting for our comprehensive annual financial report for the fiscal year ending December 31st of 2016. We received this recognition from the Government Finance Officers Association. This achievement is another testament to the leadership of the city and the excellent fiscal management practices. Moreover, we continue to receive the highest credit rating available. As recently as last month, the City of Columbus once again received a AAA bond rating from the top 3 rating agencies that evaluate municipal finance: Fitch Credit Ratings, Moody's Investor Service, and Standard & Poor's Global Ratings. Columbus is one of only a few large U.S. cities to receive this rating. More importantly, this allows us to borrow money at the lowest interest rates to finance our capital projects for our residents. This means we have more roads can be repaired, more potholes can be fixed, and better services can be delivered to our residents. In assessing where we are currently, I'm sure Deputy Director Giangardella will explain we are very well positioned. Income tax collections are slightly above the auditor's revenue estimate, and expenditures in nearly all the general fund departments are tracking below budget. I will now turn it over to Deputy Director Giangardella to share additional information about the second quarter review. The floor is yours.
Thank you, Chair Tyson. Appreciate this opportunity to come before you this afternoon and discuss the mid-year financial review for 2017. Before we get to the slides, we have some slides to go over. Just a couple comments I'd like to make about the mid-year review. And first of all, thank you for your introduction and the discussion of the city's awards. And you're absolutely right. I think it's always been a collaborative effort in how the city has managed its finances, from the mayor, administration, the auditor, and council. And we all are proud when we receive those recognitions. And we're very fortunate to be living in Columbus and to have the support of our voters and helping us with our income tax revenue. So thank you very much. As you know, overall, we are seeing an improvement in the city's financial condition with respect to the reduced expenditures projections in the 2017 general fund since the first quarter review. The first quarter, we were projecting a negative $1 million deficit in the budget, and I'm pleased to say that after we looked at the mid-year situation at the end of June, that our positive variance, we do now have a positive variance of $3.6 million, which is an overall improvement of about, just under $5 million. So we're very happy and pleased with that, and we think that will continue through the year end of 2017, the positive financial outlook. Indeed, as you mentioned, all of our general fund departments are projecting positive variances, with the exception of public safety, which we will address that in a little bit. Overall revenues, including income tax collection, which of course is the largest source of our revenues, remain slightly higher than the auditor's current revenue estimate. And even at mid-year, income tax collections were tracking about 3.9% above 2016. And I can report that we've looked at the latest numbers through September, that income tax collections still are tracking, very closely with the auditor's estimate. So obviously that's a good sign, and we can talk a little bit more about revenues as we get into the hearing. Some of the other areas, property tax collections, charges for services and investment earnings, all are tracking above, at least right now, the auditor's collections for the same period last year. There are some areas, though, that we continue to have concerns about, and of course, most notably, would be the local government fund, which is essentially the shared revenues that we get via the state. And this for some time, though that particular revenue source has been declining. I believe at one time, several years ago, that approached $60 million, and we're probably in the neighborhood of tracking about half of that right now. So obviously, that's an area where we're, it's either stagnant or just, slightly declining revenue, and we don't really see any change, any uptick in that revenue source. Overall, though, as I said, we're optimistic. There will be a positive expenditure variance increase as we complete this year for the general fund and as we continue through the months ahead. So with that, I'll go through the slides, and we can discuss some of these areas a little more in depth. Where do I point this? I might need some help moving those forward. Thank you. I don't know if I did that or you did. So our first slide essentially is just the general fund summary, and obviously it discusses what we ended the year with on the general fund, and then essentially what we appropriated, the budget appropriation, which is $872.7 million. Obviously, that's the general fund budget as it stands right now, and our projection at mid-year was slightly under that at $869 million. Therefore, the $3.6 million positive variance that we projected at mid-year. The next slide will discuss should be one back there. One, yes. The next slide basically is a summary of what we might call our three our funds. That the first one being the rainy day fund, sometimes formerly called the Economic Stabilization Fund. As I said, sometimes referred to as a rainy day fund. That is at just under $74 million, and obviously there was 2 deposits already made to that fund this year. The $2.7 million, which was projected, an additional $1 million, which came from some proceeds that we got from the Columbus Downtown Development Corporation from long ago agreements dealing with Capital South, and every once in a while we do get earnings from that, and we were fortunate enough to get just a little over $2 million this year. That's not a reoccurring. We don't anticipate that kind of money, although there could be some much smaller amounts going forward, but certainly not that kind. So we took a portion of that, as well as our annual amount of money from the budget that we put in the rainy day fund. Chair Tyson, as you know, we've the council, the administration, and we've made a commitment to increase that to $80 million because we're going to reach the original report, I believe, by the Economic Advisory Council several years ago. We were roughly at 75 million, and now we've increased the projection to $80 million. So again, we're very fortunate, but we think that we'll be able to attain that goal. The second of these three funds we named the Anticipated Expenditure Fund Balance Summary, sometimes also referred to as the 27th Pay Period Fund. And again, deposits made annually until we need to use that money, which I think we're about 4 years away from, approximately 3 or 4 years away from needing that amount of money. So we're on target in that fund as well. And then finally, what's called the Basic City Services Fund, which essentially are dollars that are not necessarily appropriated each year in the budget, but we use, it was originally set up, as I recall, to deal with the cuts in state funding that began back in 2013. So within this fund, you'll notice there has been a substantial increase from the first quarter review. And the majority of that money, or just under $12 million, is a one-time deposit and a rebate from the Bureau of Workers' Compensation. Overall, the city was reimbursed just under $15 million, the majority of that coming to the general fund. Of course, our other funds, other departments, utilities, and so forth, they also get a piece of that rebate from the Bureau of Workers' Comp. So obviously the general fund being the majority of those employees, and therefore we put that in that fund for now, and it's anticipated we'll probably need that when we complete our deliberations for the 2018 budget. The next slide is also dealing with revenue, and just a graphic that shows the comparison from 2016 to 2017, and as we had talked about a little bit earlier, obviously the largest source of that being the city income tax. And you can see from the graphic the comparison from the blue column to the green, so comparing the 2016 June actual to the 2017, as we said, we are slightly above that. And then, of course, the actual 2016 year end, the red bar, compared to the estimate for 2017. And as I said, right now, we are tracking slightly above the auditor estimate, and we anticipate reaching that number. The other sources of revenue, albeit a lot smaller, but obviously just as important for us to have a balanced budget, the charges for services, the property tax, local government fund, license and permit fees, and other miscellaneous sources. And again, with really the exception, as I point out, most notably with the local government fund, all those are, for the most part, are tracking fairly close to or slightly above the auditor estimate. The only other one at mid-year that was still slightly below was the license and permit fees. And again, obviously we'll keep a close eye on that as we go through the rest of the year. But again, overall, we do not anticipate not meeting the auditor's estimate overall for revenue for 2017. The next slide deals with any major projected surpluses or deficits in the general fund. And obviously, we'll do the good news, I guess, first, and that is that overall the non-safety department personnel savings. So when we aggregate the savings from general fund divisions that aren't within safety, we're looking at overall about a positive $2.8 million. A lot of that additional variance coming from the decrease in utilities costs, and whether that be fuel or natural gas, utilities expenses. Obviously, we've had a good fortune of not seeing those historical spikes and less volatility that we've experienced the last year and a half when it comes to those type of commodities. And of course, we're benefiting from that. Also, in what we call the city-wide account, this is a account in the general fund that's held within the Finance and Management Division for a variety of occasionally one-time expenses. They could be economic incentive payments, a variety of things, and claims. If we have an inordinate amount of claims, we use this fund to pay that. So right now we're projecting a $2 million positive variance in our citywide account, which takes me to the really the one area and the only area at this time that we're seeing a deficit, an area where I think we need to, we're focused a little more on, and that is in public safety deficit in their department, primarily in fire overtime, about just under $3 million. And as I said, outside of that division, things look very good for a positive surplus at the end of the year in the general fund budget. With respect to fire overtime, what has really happened in fire this year, essentially, is they have had an increase in their services. Obviously, we know that we're dealing with more responses for the opiate crisis, but that really is not the main contributor to what is happening in the fire division. Earlier this year, they began staffing 5 additional EMS vehicles in response to peak demand for services throughout our city. EMS response has been growing the last several years. And in order to keep up with this in certain areas, 5 additional EMS vehicles were added, which per day, those are 2-person vehicles. That's 10 additional personnel. In addition to that, earlier this year, we reopened Fire Station 6. The fire station was rebuilt there on the downtown, and that added an additional EMS vehicle. At one time, when that station was together, when it was Station 2-3, there was only 1 EMS response vehicle. That vehicle went to Station 3 when the Mitchell J. Brown station opened on Greenlawn Avenue. So when Station 2 reopened as a lone station, if you will, obviously an EMS vehicle was placed in there. So on the one hand, it is an additional response vehicle, but it's also increasing services to the city because we've added an additional, or 6th in this case, EMS vehicle. In addition to that, a permanent ladder assignment was made at Station 5 on the east end, which I believe is a station on McNaughton. That was a temporary assignment a few years ago when Station 2-3 originally closed and then moved down to Greenlawn. There was a need in that area for an additional ladder vehicle, and that became a permanent assignment when the Station 2 finally reopened here this past year. And then finally, I guess additional, in a way, good news, we did have an additional fire class this past December that was added, and while that class has already graduated and is out in the community working, it does pull resources in from the fire division to help train those individuals. And originally that was not anticipated in the budget because that was a late add, if you will. So those factors, probably as much as anything, have contributed to the additional overtime in fire. I think I can report that while they will continue, obviously, to have overtime in the fire division, that we're not seeing quite the spikes in overtime that we saw up through the mid-year. So we're hoping that some of that will moderate through the end of the year. And we'll take a close look at that, obviously, as we go forward with the 2018 budget. I believe the last slide here is a slide that addresses both police and fire overtime. I've gone in depth a little bit on the fire overtime. There is also a slight increase in police overtime, and some of that related to, we've had, an uptick in murders, unfortunately, in our community, and just the amount of work that comes with that. In addition to that, there was a slightly expanded anti-gang initiative So again, we're keeping a close eye on that, but and really in overall comparison, it is a very moderate increase in overtime to them. And at the same time, their civilian overtime is held in check. So outside of these two issues, I'm happy to say that I think all trends would point to a very positive outlook for the remainder of this year for the general fund budget. And I'd be happy to answer any questions that you may have.
Well, thank you for your presentation, and I was waiting till you finished so I could ask some questions. So, one, I want to certainly commend Director Joe Lombardi and the administration, especially all the departments who are certainly under budget, because that certainly does help the situation as we move forward. And so just want to publicly say thank you for everyone that, I know most of it's controlled around personnel costs. So just really appreciate that what most of the departments are doing, as you just mentioned too, around the commodities is also helping us to be able to have right now the looking at the right number, the 3.5 or 3.6 million dollars right now in terms of our second quarter projections, and so I'm also thankful that we've received the one-time deposit of that $11 million, because certainly it will help us, as you just mentioned, as we're planning for the 2018 budget, to be able to have those dollars available for to carry over, because we typically carry over about $32 million. Is that correct?
Yes, usually that is about, when we look at projecting for the next year's budget, usually, increased costs, the inflation, obligations that we have. Certainly, it's not out of the realm that we're going to need to, find an additional $30 million in order to meet all of our commitments for 2018 and continue the services that our residents expect. Yes.
Thank you. And so, again, very thankful for that. And so just brings some concern about the 2019 budget based upon, we hope that we can continue to attract and retain jobs within our community, and certainly attracting a lot more, because we're of course, you just mentioned, we're an income tax-based city, and we need to make sure that when we're having conversations around, incentives to businesses, that it's just so important that since we are an income tax-based city, that we're doing everything in our power to attract and retain businesses in our community. So, if I look at, we just mentioned this issue around police and fire, and mostly around the fire overtime. And as you said, we've added really 6 EMS. We now have a permanent ladder. And so my question is thinking, because I know you're working on the 2018's budget, since we have added these additional, vehicles, additional personnel, are you anticipating that the budget will look different from this year to next year because of we have these additional personnel?
Well, as you know, we're obviously going through those deliberations really now in crafting the mayor's 2018 budget. I certainly, at this time, I don't anticipate, I guess we anticipate a continuation budget. So yes, obviously, it's a challenge, but it's one that we always manage to work through. That it's anticipated that we will continue to have these additional resources that are committed to fire. With respect to overtime, obviously, we work close with the Department of Public Safety, and we're doing everything we can to ensure that they have the resources that they need to meet their obligations. As you're well aware, being finance chair, that public safety has been and will continue to be a high priority for this administration, for Mayor Ginther, and it's our charge to make sure that we're providing the resources necessary for our safety forces and for our other departments and divisions to carry out their obligations.
Thank you. And the reason I was asking just that question is because since we know that we've added, it's so that it doesn't look like it's so that their budget is they're over budget by such a significant amount, is that once we know that we're adding personnel, that it just might as well be in the budget, and so that we're not looking at that being the issue. So that's why I was asking that question. And certainly, as you're saying, it just said that we have more runs, we know what the staffing levels look like, and but our number one priority is always going to be the safety and welfare of our communities. And so we just have to know that people have to realize that as we're spending those dollars, it means we're having to tighten other areas. We're still providing the resources to our community, but again, I know that you guys are working with the safety director to try to look at how we can, make sure that we're not trying to go over budget. But again, there are situations where, based upon what's needed for our community, that will happen. The goal is, though, that we continue to have a continuation of services moving forward. And I know that's your number one goal, too.
Yes, that's correct.
Okay. Well, I think we have a plan that I feel a little better that even though, the first quarter review, we had we had a negative, almost $1 million in a deficit. We've 4.6 million pretty much came in. We now at 3.5, and with the $11 million that we could possibly be using next year for a little better, we'd be at about almost half of the amount that we would need to move forward. And looking forward to the second half of the year to begin to continue to hopefully that the deficit in terms of safety will not continue to go up, and that we would be able to continue to manage the costs with the personnel and with the commodities as you've talked about tonight.
Yes, obviously, the third quarter has actually ended, and we are now into the fourth quarter, and our analysts and finance are busy crunching numbers and working with each of our departments to see what that third quarter projection will look like. Again, I'm very optimistic that we'll continue these positive trends that we see here this evening in the mid-year review.
Thank you very much for presenting the second quarter review, and I look forward to having the third quarter review. I know it just ended last week, and once you crunch the numbers and share them with the administration, I know we'll be sharing them again with our viewing and listening audience. So, and
thank you. I appreciate your support as well.
Oh, thank you so much. All right, so we'll now move forward, and I think we're going to you're going to leave your seat, and I think Mr. Chris Long is going to come in and present the legislation moving forward. And everyone else can take their positions too. So I see that, Dr. Williams-Roberts is here, and Melinda Frank is in chambers, and we'll go ahead through the rest of the legislation. Our next speaker covering the legislation from the Finance Department is Chris Long. Chris, the floor is yours.
Good evening, President Pro Tem Tyson.
Good evening.
Our first item to present to you this evening is actually a resolution. It's Resolution 0252X-2017, and this seeks authority to declare the City of Columbus's support and approval for the Solid Waste Authority of Central Ohio, also known as SWACO, their solid waste management plan update for the period covering 2018 to 2032. SWACO's mission, as you know, is to improve the community's solid waste stream through effective waste reduction, recycling, and disposal. SWACO's jurisdiction includes Franklin County and political subdivisions with over 50% of their population in Franklin County. And tonight, Mr. Kyle O'Keefe, who is the Director of Innovation and Programs for SWACO, would like to say a few words about the plan.
Kyle, please come up to the podium. Good evening.
Good evening, Council Member Tyson. Thank you for having me here this evening. I'm Kyle O'Keefe, the Director of Innovation and Programs for SWACO. Just here to speak briefly about our solid waste management plan. As a solid waste authority in Central Ohio, we're required by statute every 5 years to revise our solid waste management plan. The solid waste management plan basically outlines the types of programs and services that we offer to help reduce waste, increase recycling, in and throughout Franklin County and all of its communities. As we go through the plan and we create it, we also ask all of our communities, we have 41 communities, sub-communities in Franklin County, to vote on that plan for approval to pass it. So here tonight to kind of talk a little bit about the plan, answer any questions you might have, and ask for your support for the plan. Some of the highlights included in the plan focus on some new initiatives really to help increase awareness and education. One of the new initiatives we plan to launch in 2018 is a large educational campaign really targeted at helping residents and businesses better understand what's recyclable, how to recycle properly, how to increase participation in recycling. Some other highlights included really new programs targeting public facilities, businesses, and institutions, or what we call the commercial sector. It's actually where the majority of the waste that's generated in landfill today is generated. So really an opportunity to make an impact there. But we've also included some new initiatives around food waste specifically. In fact, we've really appreciated participating in the local food waste action plan. And as you may know, one of those primary goals there is to help reduce food waste. So we've actually been able to integrate that into part of the programming in this plan that will help to target and rescue food and give that to those in need, but also compost and better make use of the value of that food waste. There's a lot of other information included in the plan too. We're also actively kind of evaluating some of our longer standing, more historical programs to make sure they're operating as efficiently and effectively as possible. Hopefully we'll see some improvements in those areas too. Those include programs such as our Household Hazardous Waste Program, which we have a facility located here in Columbus off of East 8th Avenue to accept household hazardous waste from residents and be able to properly dispose of that material. In fact, there is a household hazardous waste collection event coming up that we work with the City of Columbus on October 21st at the Ohio History Connection Center. That's available to all residents as well. But those are the types of programs that are included in this plan. And really the goal overall of this plan is to help make Central Ohio, Columbus, and all of our communities in Franklin County really a leader in the state and a leader in hopefully the country and the region in terms of waste reduction and recycling. And I'm happy to answer any questions that you might have about the plan.
Well, first, Kyle, thanks for coming down and sharing. I know that my council colleague, Elizabeth Brown, will certainly be excited. I know she's working closely with you from the environmental standpoint. And then also I think Councilmember Harden is probably very much involved in this also. So all of council members certainly do care about the Solid Waste Authority's mission and how it affects our residents in Columbus. Just last night at council, this topic came up and about the making sure that more individuals are participating, residents are participating in recycling. And we were talking about just the marketing. I mean, I'm sure you know what the zip codes are, where we need to increase that, and that hopefully that your plan would be a personal plan based upon the individuals that are residing in those communities, what would really get them actively involved in recycling. And so just my question to you is that, are you working with any agencies to help you with this the marketing of those to our residents?
Yeah, absolutely. That's a great question. I can say that we've been very fortunate to work closely with the Columbus Refuse Department, on a number of initiatives. We've been in close communication and planning around a number of our programs, including this one as well. So we really see this as an opportunity in the future to create more awareness and create some targeted messaging too, depending on the communities and what might appeal to them in terms of this issue to help encourage them to participate in recycling.
I think that's really important because just like I would just say, you mentioned the food plan, and as we're having discussions with different communities, it's what is how are you going to market to, what's that community want to hear that would get them very excited about recycling? And so hopefully working with the city, but also thinking about, is there, I don't know what this, who in the community, as we're doing targeting marketing around even like Celebrate One and the ABCs of safe sleeping, it has to be meaningful to that particular audience. So we just look forward to hearing about your plan in terms of recycling, because we all want to make sure that more individuals in our community are recycling, because it certainly doesn't cost us any less if everyone's recycling. And so we'd hope that we could help you to do that and and increase the participation in the recycling plan.
Absolutely, 100%. Those are great recommendations, and we'll definitely take those into consideration as we develop that marketing plan to reach those audiences.
And you just mentioned that there's going to be, the hazardous waste drop off October 21st. So can you share with the viewing listening audience what kind of items that they should be bringing to this event, and the time of the event?
Yeah, absolutely. All of that information is also included on our website too, just so if the listening audience wants to look it up, if they go to swaco.org.org, under our residents section, there's a household hazardous waste program. And it actually includes a full list of what's accepted in this program and at that event. Includes items such as flammable materials, gasoline that might have gone old, pesticides, herbicides, oil-based paint. So there's a large list of items there that can be brought to this event, and I would suggest taking a look at that list on our website just to reassure that you're bringing the right or appropriate material. And then again, if they can't make it to that event, we do have hours during the week that are available at our permanent facility to go and drop off those materials too.
Thank you. And again, the solid waste management plan overview is required by the Ohio Revised Code and Ohio EPA, and all solid waste districts and authorities must develop and revise a solid waste management plan approximately every 5 years. And the purpose of this legislation is to address state mandated goals and outline programs and initiatives to reduce reliance on landfilling, increase recycling and reuse, and minimize waste generation. And thank you very much for coming down and sharing.
Thank you, Council Member.
You're
Appreciate
welcome.
it.
Thank you.
President Pro Tem Tyson, this evening we have a total of 11 ordinances for your consideration that we anticipate will be on the October 16th City Council agenda. The first being Ordinance 2479-2017. This seeks authority for the Finance and Management Director to enter into a professional services contract with a vendor by the name of Orchard, Hiltz, and McClement. And this would be for professional services related to the renovation of the Courtyard Plaza at City Hall. Essentially, what we've experienced over the last few years is, unfortunately, ever-increasing water intrusion around the foundation and into the underground parking garage here at City Hall. And if left unaddressed, it could cause foundational and structural issues in the long run. And so this ordinance seeks authority to enter into contract with Orchard and Hiltz to begin the design work on the replacement on a phased construction schedule of the concrete apron around City Hall. It would be, like I said, it would be designed in phases, so we would all have the option to move forward on a phased replacement and renovation project.
Thank you. And this was bid, and the expenditure is it's $380,000, correct?
That is correct.
All right, thank you.
Our next ordinance for your consideration is Ordinance 2499-2017, and this seeks authority for the Finance and Management Director to renew a contract on behalf of our Facilities Management Division with Dove Building Services for custodial services at the Columbus Public Health Building, 240 Parsons Avenue. This is essentially an outsourced third-party custodial services contract at our health department.
And this is the third of 4 annual renewals for $316,000.
Actually, it'd be for $309,000, but you're correct, President Pro Tem Tyson. Last year's expenditure was $316,000, so it's a little bit of a cost reduction for us this year.
Oh, 309.
Correct.
Thank you. Okay. Thank you.
Ordinance 2520-2017 is our next ordinance. This seeks authority for the Finance and Management Director to establish a universal term contract with Biological Consulting Services of North Florida for laboratory water analysis. This will be used primarily by the Division of Water, and it's used to test water for microbial contaminants such as cryptosporidium would be one of the more prevalent contaminants right now.
Thank you. The Division of Water is a primary user, and it's to continue to make sure that we have clean, safe water for our residents. And the annual expenditure is $30,000.
That's correct.
Thank you.
Our next ordinance, Ordinance 2521-2017, this seeks authority for the Finance and Management Director to enter into a contract on behalf of the Facilities Management Division with DeBra Kemple. This would be for the replacement of 2 compressors on chiller number 1 at the Columbus Police Academy. Essentially, those compressors have exceeded their useful life and can no longer be maintained, at least in the long run, properly. So this seeks the authority to replace those, and this was a competitively bid project.
This is part of our plan of looking at our compressors and replacing them so before they become an emergency?
Absolutely.
All right, thank you. And this is for $61,830.
That's correct.
Thank you.
The next ordinance, 2589-2017, this seeks authority to adopt the 2018 action plan, which implements the 4th year of the 5-year consolidated plan for the Community Development Block Grant, also known as CDBG, also the Home Investment Partnership, or the HOME program, the Emergency Solutions Grant, or ESG, and the Housing Opportunities for Persons with AIDS, or the HOPWA program. I believe, if my notes are correct here, there's a public hearing that's scheduled on October 25th, where I know this will certainly be discussed in more detail. And my understanding, though, right now is that from in totality, the funding levels will remain roughly consistent in 2018 as they are currently in 2017. But I believe it's the plan for each department, Recreation and Parks, Health, Development, Neighborhoods, and Finance, to brief you on any programmatic changes that may occur.
Thank you. Yes, Mr. Longwell, I think the plan is October the 25th. We'll have a hearing, and the estimated revenues from the past has been about $12.4 million. And so we look forward to having the hearing and hopefully having the same amount of dollars coming into our community. Thank you.
Thank you. Our next ordinance is Ordinance 2596-2017. This seeks authority for the Finance and Management Director to modify past, present, and future contracts and purchase orders with Abraxas LLC. This is simply due to a federal tax ID number change due to a corporate restructuring.
Thank you.
Our next ordinance is Ordinance 2612-2017. This seeks authority for the Finance and Management Director to establish a universal term contract with Xylem Water Solutions, USA. This would be for flight pump parts for use by the Division of the Sewer and Drainage Department.
Thank you. And the estimated expenditure is $100,000.
That is correct.
Thank you.
Our next ordinance, 2621-2017, this seeks authority for the Finance and Management Director to establish a universal term contract with LKQ Keystone Automotive for the purchase of auto glass and auto body parts, largely used by our Fleet Management Division to repair city vehicles.
Thank you. And again, that's the estimated value is $30,000.
That's correct.
Thank you.
Ordinance 2665-2017 is our next ordinance. This seeks authority for the Finance and Management Director to enter into a memorandum of understanding with the Franklin County Commissioners in order to reimburse the county for the city's portion of Ohio Public Employee Retirement Systems, or OPR's, liability cost associated with a state Supreme Court case, Altman Bates versus the Public Employees Retirement Board, for an amount equal to approximately $3 million. And this is essentially relates back to employees of the Franklin County Public Defender's Office were originally deemed by the county to be independent contractors, not public employees, and as such would not be eligible for pension fund contributions. The state Supreme Court disagreed with that and deemed that they would be eligible and are eligible, and those contributions should be made. And as you know, you have been instrumental in supporting this initiative. The city partners with the county for what we call the Franklin County Public Defender contract. So the city essentially helps pay for legal representation for indigent the City of Columbus residents. And so since we share the cost of the operation of that office, we should share in the cost of those pension fund contributions. And so that's what this ordinance seeks authority from council to do.
Thank you. And again, this really dates back to individuals that were hired between 1985 and 1992. And then dating back to 1999, the obligation, the Mallory case was approximately $3.7 million. And so this will authorize $7 million to settle these claims. And again, I know there may be an additional settlement also. So thank you for giving us some background information on this. And certainly, I'm sure we'll discuss it also again the night of the hearing, but I'm certainly obviously in support of sharing this cost with the county commissioners to pay the retirement cost from this lawsuit to these individuals.
Thank you.
Thank you.
And then we just have two other ordinances. They're related. These are, President Pro Tem Tyson, two bond refunding ordinances. There's ordinance 2660-2017 and 2661-2017. The 2660 ordinance is for previously issued voted debt, and ordinance 2661 is for previously issued unvoted debt. And these would just be similar to previous bond refunding ordinances that we have sought authority for. Our Department of Finance, in working in conjunction with our city auditor, have determined that there are some previously issued voted bond packages that essentially we could get better interest rates on.
Thank you, Mr. Long, and certainly I know that Auditor Dorian is always looking at the changes in the rates, and when there's an opportunity for us to be able to save additional dollars for our residents, he then will look to refund some of our debt at a lower cost, so that again we will save dollars for our community. So I'm always in support of that, and look forward to having this legislation on from my colleagues who support.
Thank you very much, President Pro Tem Tyson.
Thank you so much. Our next speaker this evening is from the auditor's office, and it is Income Tax Division Administrator, Ms. Mindy Frank. The floor is yours.
Thank you. Good evening, President Pro Tem Tyson, The Office of the Auditor, Division of Income Tax, has one piece of legislation that would be on the October 16th council agenda, and that would be ordinance number 2519-2017, and it would authorize the expenditure of $27,000 for software technical support, maintenance provided by our software developers, specialized business software, related to the Income Tax Division's e-file e-pay application for individual taxpayers, as well as for the internal workflow application used by the division in the processing and auditing of all returns filed with the division. The division has contracted annually for provision of these services based upon a percentage of the cost to develop the applications. Such funds would also be utilized for the maintenance and technical support and monitoring provided by our software developer with regard to the third-party host for the e-file e-pay application. The cost of these services is also tied to the development costs of related software programming. These bifurcated services provide complete coverage for the purposes of the division in maintaining an operational application for taxpayers and income tax staff.
Thank you, Ms. Frank, for providing information on this legislation, and just appreciate the Auditor's Office for being an efficient office and providing taxpayers the ability to file their tax returns with the division's income tax electronically. It saves them time, and we get those dollars in pretty quickly, and so just appreciate that.
Yeah, well, thank you. That's our goal.
Thank you. Thank you. So happy to present this to my colleagues at our next council meeting, and I'm sure they'll be supportive.
Thank you.
Thank you. And our final presenter this evening is going to be from Health and Human Services Committee, will be Dr. Mashika Williams-Roberts, the Assistant Health Commissioner and Medical Director. The floor is yours.
Thank you, and good evening, President Pro Tem Tyson. Columbus Public Health has 7 items on our agenda this evening that I'd like to go over with you. The first is to authorize contract for Hologic GenProbe, which is ordinance number 2513-2017. Columbus Public Health provides chlamydia and gonorrhea testing for patients at the STD clinic and various other clinics in the city of Columbus. Columbus Public Health uses a highly effective DNA probe test for chlamydia and gonorrhea. The DNA probe test kit has high sensitivity, specificity, and transportability characteristics, much more than other types of testing methods. Hologic GenProbe is the sole provider of the DNA probe test kit, which is the only FDA-approved test kit available in the United States. This ordinance authorizes the purchase of test kits in the amount not to exceed $75,000. And I would just like to add, this will give us approximately 5,000 test kits, and we would be able, our clinic serves approximately 12,000 clients per year.
Thank you. I don't have any questions.
Next, I'll have to accept and appropriate a grant for Safe Communities, which is ordinance 2567-2017. Columbus Public Health has been awarded a grant from the U.S. Department of Transportation through the Ohio Department of Public Safety. This ordinance is needed to accept and appropriate $125,000 in grant money to fund the Safe Communities Grant Program for the period of October 1, 2017 through September 30 of 2018. The Franklin County Safe Communities is a traffic safety program of Columbus Public Health funded by the Ohio Department of Public Safety. The mission of Franklin County Safe Communities is to reduce the number of traffic-related injuries and fatalities through interventions that convene resources, educate the community, and change the built environment. Any questions?
Thank you. And you're focusing on seatbelt use, impaired driving, distracted driving, motorcycle safety, and teen drivers, and pedestrian safety. And if our viewing or listening audience would like to have presentations from based upon the appropriation of this grant, how would they be able to gather information to have someone come out and speak with their groups?
That's an excellent question, and we would be more than happy to do that. The person they would want to contact would be Carissa Harvey, and that's Carissa with a K. Carissa can be reached at 614-645-6138. That's 614-645-6138.
Thank you.
Thank you. Next, we have ordinance number 2468-2017 to enter into a contract with various vendors for the WIC grant. The Board of Health has been awarded a grant from the Ohio Department of Health for the Women, Infant, and Children's Program. Columbus Public Health has been designated as the primary grantee agency and administrator for the WIC program in Franklin County. The grant funds awards provide for multiple contracts to meet various grant deliverables in the amount not to exceed $634,100 among the contracts. The contracts named in the approved grant application are the Research Institute for Nationwide Children's Hospital. They will receive $584,100. Primary One Health, they will receive $28,000. And Ohio Support Service Corp., they will receive $22,000. Franklin County WIC is the largest program in Ohio and currently serves 34,450 clients. There are 15 locations throughout Franklin County. 9 are Columbus Public Health WIC clinics, and 6 are Nationwide Children's Hospital WIC clinics. We operate Monday through Friday.
Thank you. Dr. Roberts, can you just share some of the services that people get through the WIC clinics?
Absolutely. So as the name implies, women, infant, and children, this is a nutrition supplementary program through the federal government. And so the people who are eligible would be pregnant women and women who are taking care of children under the age of 5 if they meet the income requirements. There are no residency or citizenship requirements for WIC, and I want to make sure that I emphasize that. And we provide them with vouchers to help them pay for food that they can get when they go to the grocery store, just like anyone else, as well as formula if they are have a child who's on formula.
Thank you. And I see that if someone is in need of the services, they can contact Miss Dawn Sweet?
That is correct, at 614-645-6755. That's 614-645-6755.
Thank you.
Next, we have ordinance number 2467-2017 to enter into a contract with Key Cleaning Connection. The Board of Health has been awarded a grant from the Ohio Department of Health to fund the Women and Infant and Children's Program for the period of October 1, 2017 through September 30 of 2018. The grant funds awarded will provide for a janitorial service contract for an amount not to exceed $37,133.64. The RFQ 006401 was bid of the city's vendor service website. An evaluation of all bids received was performed, and it was determined that Key Cleaning Connection was the lowest, most responsive, and responsible bidder.
I don't have any questions. Thank you.
You're welcome. Next, we have ordinance number 2439-2017 to authorize a contract with NextGen Healthcare Information Systems, LLC. Columbus Public Health uses NextGen for provisioning, hosting, and ongoing support of our electronic medical record system at CPH's 240 Parsons Avenue facility. NextGen will provide training and consulting services to convert the alcohol and drug program from their current EMR system, Avatar, to the behavioral health module in NextGen, in accordance with the sole source procurement provisions of the Columbus City Code. The NextGen system provides a necessary and more flexible, up-to-date coding environment than Avatar for AOD counselors to document patients' medical charts. This contract will be for the period of November 1, 2017 through October 31, 2018, with a total cost not to exceed $97,137. The alcohol and drug prevention program serves approximately 5,800 adults, young adults, and their families, as well as 4,800 children and adolescents through the Columbus City Schools, after-school summer programs, and recreational centers. In addition, we have a harm reduction program which serves about 1,200 adults. The treatment program will provide treatment services to approximately 1,100 men and women, and of those, I can tell you the majority are men, with 68% of our treatment program clients being men.
And it's important that you are able to have their medical records up to date, and just to show the number of individuals that the number of records you have to keep for the 5,800 adults, children, and young adults, as well as the 1,200 individuals through the harm reduction program. Thank you.
Correct. You're welcome. Thank you. Next, I have ordinance number 2515-2017 to authorize a contract with Cribs for Kids. This ordinance authorizes the Director of Finance and Management to establish a purchase order with Cribs for Kids for the purchase of baby safety survival kits not to exceed $51,993.50. The purchase of the portable cribs is a grant requirement as part of the Franklin County Department of Job and Family Services Safe Sleep Grant. Cribs for Kids, a not-for-profit agency, is the sole provider of the Graco pack-and-play portable cribs. It was determined through hands-on testing and a review of the Consumer Product Safety Commission reports that the Graco Pack-and-Play is by far the safest and most reliable because their units contain all of the patented safety mechanisms that continue to make them the leader in this industry. The Columbus Public Health Department has an existing licensed trade agreement with Cribs for Kids. This funding of the portable cribs, also known as pack-and-plays, will enable us to serve an additional 650 caregivers and families by providing a safe sleep surface for babies who otherwise would not have had a safe sleep place. In 2016, CPH and our community partners, because we can't do this alone, distributed over 1,100 portable cribs to caregivers and families who otherwise would not have had a safe space to sleep their child. In 2017, through September 22nd of 2017, CPH and our partners have already distributed 1,013 portable cribs. So this would allow us to distribute another 650.
Thank you, Dr. Roberts. And just appreciate the effort of Columbus Public Health in terms of the ABC's a Safe Sleeping Program. You just mentioned all the partners, but just think about, we want to make sure that our kids are alone on their back and in a crib. And for those families who certainly could not afford to have a crib, that this will, by having this grant, will allow those families that you're saying 650, but you've already in 2017 have given over 1,000 of these portable cribs. And so again, this means kids aren't sleeping in the bed with their parents, not sleeping in places where they should not be sleeping, and and gives them the opportunity to live, hopefully with all the other kinds of resources we're providing, to live past their first birthday. And I'm just very thankful to be able to receive these grant dollars from the Franklin County Department of Job and Family Services to ensure that our children are sleeping in the right environment. If families are in need of a crib, how can we get those to them?
Absolutely. If they're in need of a crib here in our community, they can call 311 or 645-3111. But 311 would be the best way to go, and they will direct them to the program who can provide this for them. And President Pro Tem Tyson, I would be remiss if I didn't include the fact that when the families get these cribs, they are not just getting the cribs. They are going through an educational training with our staff to go over the ABCs of safe sleep that you mentioned, as well as learning how to correctly assemble and disassemble the crib. So there is an educational component as well as giving them the pack and play.
Thank you, Dr. Roberts.
You're welcome. And lastly, we have ordinance number 2572-2017 to accept and appropriate Minority Health Month 2018 grant. Columbus Public Health has been awarded a grant from the Ohio Commission of Minority Health. This ordinance is needed to accept and appropriate $7,500 in grant monies to fund the Minority Health Month grant program for the period of January 1, 2018 through May 31st, 2018. The purpose of this grant is to provide funding for billboard advertisement, health screenings, and additional activities occurring at Minority Health Month events to help increase minority health awareness in Columbus communities. CPH organized 12 Minority Health Month initiatives in 2017. Minority Health Month activities directly served 1,700 community members and provided 602 health screenings for blood pressure, blood glucose, and immunizations. The billboard advertising campaign reached an estimated 153,000 residents, raising awareness for minority health initiatives.
Thank you, and just appreciate getting these dollars from the House Commission on Minority Health and Dr. Dawson, and who's leading that the commission. But I also want to say a thank you to Ryan Johnson and his team for the great work that they do on a daily basis, but certainly the focus on Minority Health Month in April of each year to again have reached 1,700 community members and provided the 602 screenings. So just appreciate his leadership and the whole team that's around Ryan. So thank you. The other question, I'm kind of just asking another question about the cribs. Can anyone receive these cribs or in need, or are there any financial issues or concerns around that, or is it available to anyone?
You know, that's an excellent question. I believe that they're available to anyone, and there aren't any financial restrictions. If you say you need a place for your baby to sleep, we will provide that for you.
Thank you very much. Okay. Well, I hope this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health, as well as finance-related legislation as necessary to support our ongoing city operations. Further, I hope the financial review offered tonight is useful information helping viewers understand the city's financial position. As residents, these hearings are an opportunity for you to learn and become engaged in issues that are presented. Before we conclude tonight's hearing, I want to again thank from the Department of Finance, Dan Giangardella, the Deputy Director, and Chris Long, the Fiscal Manager. From the Auditor's Office, Melinda Frank, the Income Tax Division Administrator. From Columbus Public Health, Dr. Mashika Williams-Roberts, the Medical Director and Assistant Health Commissioner. My fellow council members and their staffs who serve our community with pride every day. City Council's Legislative Research Office, especially Michael Kessler, who leads the Legislative Research Office. Matt Erickson, who staffs the Finance Committee. Alexis Pennell, who staffs Health and Human Services. Nancy Pryor-Sully, who just had a wedding anniversary yesterday. How many years, Nancy? 34 years for Nancy, who is a part of our team, and she is the council's community council's community engagement team. She focuses a lot of her time on the south side of our city. My staff, Nicole Harper and Carl Williams, the hardworking team at CTV who make these hearings possible, and last but not least, all the residents of Columbus who make our city the best place in the country to live, work, and to raise a family. This hearing is now adjourned. Thank you.